Good afternoon. I'm very happy to be here. And today I will present our work. This work, we verified the association between daily alcohol consumption with assessed by audit-C and recall in grams with falls and recurrent falls in 315 people living with HIV from the PROSPER study, adjusting by age, sex at birth, race, ethnicity, sites, and other variables. In table 1, it's small, but we can see, yeah, I have some notes here. In table 1, we can see that most of the participants were male, non-Hispanic black, and they told that the average of alcohol consumption daily was 5 grams. And they reported 19 and 9% of falls and recurrent falls in the last 12 months. In table 2, we verified the association between falls and recurrent falls only for hazardous alcohol use status assessed by audit-C. And in table 3, even after adjusting by age, sex, race, ethnicity, sites, and individually by SPPB, EGF, and diabetes status and treated hypertension, we verified the association with any type of falls only with hazardous alcohol status assessed by audit-C. In conclusion, we verified the association between hazardous alcohol consumption only assessed by audit-C with falls in people living with HIV. Thank you.
Yeah.